Good day, everyone. Today, we will be discussing lymphatic disorders and immunity. But before that, allow me to read the overview of our topic. So, the lymphatic system is a network of vessels, nodes, and organs that transport a clear fluid called lymph throughout the body. The primary functions of the lymphatic system include maintaining fluid balance, filtering harmful substances, and supporting the immune system. And also, allow me to introduce to you my teammates. I am Janelle C. Quaresma. We have here Miss Diana Rose de los Santos, Miss Bianca Binayug, Miss Evitaline Quaresma, Miss Janine Carpuz, Miss Ambrin Dudok, Miss Kathleen Danga, and the last but not the least, we have here Miss Dreampearl Binkan. So let's proceed to the lymphatic disorders and immunity. The number one disorder is the lymphadenitis. When we say lymphadenitis, it is the inflammation of lymphatic vessels as a result of bacterial infection. Appears as painful red streaks under the skin. For more information, lymphadenitis is an infection of the lymph nodes. It is also called lymph glands. It is a complication of certain bacterial infections. So the causes of the lymphadenitis is the lymph system, is a network of lymph nodes, lymph ducts, lymph vessels, and organs that produce and moves a fluids called lymph from tissues to the bloodstream. The lymph glands or lymph nodes are small structures that filter the lymph fluid. There are many white blood vessels in the lymph nodes to help fight infection. It is also occurs when the glands become enlarged by swelling or inflammation, often in response to bacteria, viruses, or fungi. The swollen glands are usually found near site of an infection, tumor, or inflammation. Lymphadenitis may occur after skin infections or other infections caused by bacteria such as Streptococcus or the Staphylococcus. But sometimes it is caused by rare infections such as tuberculosis or cat scratch disease. The next one is the lymphangitis. When we say lymphangitis, it is swelling of tissue with lymph caused by obstruction or excision of lymphatic vessels. Lymphangitis is an infection of the lymph vessels or the channels. It is a complication of some bacterial infections. The causes of this is the lymph system is a network of lymph nodes, lymph ducts, lymph vessels, and organs that produce and move a fluid called lymph from tissues to the bloodstream. Lymphangitis most often result from an acute streptococcal infection of the skin. Less often, it is caused by a staphylococcal infection. The infection causes the lymph vessels to become inflamed. Lymphangitis may be a sign that a skin or a soft tissue infection is getting worse. The bacteria can spread further into the blood and cause life-threatening problems.
So next is lymphedema. So lymphedema is a buildup of lymph fluid in the fatty tissue just under your skin. This buildup might cause swelling and discomfort. It often happens in the arm or leg, but can also happen in the face, abdomen, and or trunk. Lymphedema signs and symptoms which occur in your affected arm and leg include swelling of part or all of your arm or leg, including fingers or toes, a feeling of heaviness or tightness, aching or discomfort, recurring infections, a dull ache in the affected limb. The causes of lymphedema is any condition of procedures that damage your lymph nodes or lymph vessels can cause lymphedema. We have two types of lymphedema, the secondary lymphedema and primary lymphedema. The secondary lymphedema is the surgery that results in removal or injury of lymph nodes, radiation treatment for cancer. So the causes of primary lymphedema are the Milroy's disease, also known as congenital lymphedema, the Mejia's disease, also known as lymphedema precox, the late onset disease, also known as lymphedema tarda. To reduce the risk of lymphedema, avoid heat on your arm or leg. Avoid tight clothing. Rest and protect your arm and leg while recovering. Keep your arm or leg clean. So next is lymphoma. Lymphoma is a cancer of lymphatic system. Lymphoma is a type of blood cancer that affects lymphocyte, the white blood cell that form part of the immune system that helps fight infection. There are two main types of lymphoma, the Hodgkin and non-Hodgkin lymphoma. The Hodgkin lymphoma is typically begin in the upper body such as the neck, chest, or armpit. The non-Hodgkin lymphoma may arise in lymph nodes anywhere in the body. The signs and symptoms of lymphoma are unexplained fever and weight loss, swelling of one or more lymph glands such as in the neck or armpits, tiredness, bruising or bleeding easily, cough, chest pain, or problems breathing. Treatment depends on the type of lymphoma you have as to what treatment you need. You might have drug treatment, radiotherapy, and a stem cell transplant.
Good morning, everyone. Good morning to our dear clinical instructor, Sir Joshua Cabaya. I'm Bianca Binayug, and now let's talk about immunity. So, what comes into your mind when you hear the word immunity? Immunity is the ability to resist the harmful effects of microorganisms and other foreign substances. Adaptive immunity exhibits specificity and memory. So, innate immunity does not show specificity and memory. These are specialized cells or part of the immune system offer the body protection against diseases. This is called immunity, or this protection called immunity. Let's proceed to the innate immunity. Everyone is born with innate or natural immunity, a type of general protection. For example, the skin acts as a barrier to block germs from entering the body. The immune system recognizes when certain invaders are foreign and could be dangerous. So let's proceed to the adaptive or active immunity. Immunity develops throughout our lives. We develop adaptive immunity when we're exposed to diseases or when we're immunized against them with vaccines. Let's proceed to the specificity. This is the ability of adaptive immunity to recognize a particular substance. So, the ability to recognize all pathogens especially and to provide enhanced protection against reinfection.
Memory, ability to adaptive immunity to remember previous encounters with a particular substance, thus future responses are faster, stronger, and long-lasting. Interferons are proteins that protects the body against viral infections, and a protein produces body cells that fights viral infection and certain cancers.
I will discuss to you the competent and body-mediated immunity. So, Competent refers to a group of 20 or so proteins that circulate in the blood in an inactive form, provides a major mechanism for destroying foreign substances in the body. Next, we have body-mediated immunity, effective against extracellular antigens such as bacteria, viruses, and toxins, also involved in an allergic reactions.
IgG activates complements. Increased phagocytosis can cross placenta. Those can provide immune protection to the fetus and newborn, responsible for Rh reactions. Now, the IgG antibody class that play a crucial role in the immune system. Additionally, IgG is involved Rh reactions important in situations like Rh incompatibility during pregnancy.
IgA. IgA is secreted into saliva into tears and mucous membranes found in colostrum and milk. IgM acts as antigen binding receptor on surface of B cells, responsible of transfusion of reaction in ABO blood system. For IgM is the first antibody secreted by the adaptive immune in response to a foreign antigen. For example of function of IgM is the first antibody isotype to appear during exhalation, ontogeny, and immune responses. IgM not only serves as the first line of host defense against function as it also plays important role in immune regulation and immunological tolerance.
Cell-mediated immunity is essential for fighting viral infection. The immunity is arising from T cells recognizing and eliminating its malignant or contaminated cells within the body that is called as the cell-mediated immunity. The main function of this cell is to prevent and kill microorganisms to enter our body systems and to prevent us from getting sick easily. Our body is attempting to protect itself by enveloping and eliminating the intracellular germ in an attempt to prevent its invasion. In order to prevent ourselves from getting sick, the T lymphocytes is the one who is being activated to fight. Immunotherapy. Immunotherapy treats the disease by altering immune system function by directly attacking harmful cells through stimulation and inhibition. Immunotherapy is the one that boosts our immune system to fight microorganisms who wants to enter our body. This will also kill or destroy the cancer cells of those people who have cancers, and usually they call it chemotherapy.
And that's all for today, guys. I hope may napulot po kayong aral sa aming discussion for today.